Hey everybody, it's Kristin from Studio 913, and today I have with me Briana Kramer from Healthcare Solutions team. Good morning, Briana. How are you?
Hi, good morning. I'm great. How are you doing?
Very good, thank you. So Brianna actually works with Healthcare Solutions team. She sells insurance, life, dental, health, being the biggest one. And I just wanted to pick her brain because, obviously we're in the middle of a pandemic, and I know there's a lot of things changing for people out there. And I just thought Brianna's been a wealth of information. We actually got our health insurance through her, and she was absolutely wonderful. We actually ended up with a much better plan than we had before, for about the same cost. So thanks for that.
You're welcome.
um, so Brianna, can you tell me a little bit about what it is that you do with Healthcare Solutions team, what kind of products you guys offer, and then we can go into some of the questions we have.
Sure. I'm a health insurance broker, which means that I'm a non-captive agent. So I can contract with several different carriers, which is better for my clients because I can pick and choose from each carrier the things that I like and build them a customized plan that will suit their budgets and their needs.
So what kind of options do you have if and I know a lot of people have been laid off from work. What kind of options do you have? I mean, I know Cobra's the big one out there, but are there any other options that people have to get health insurance during this time?
Yeah, absolutely. So Cobra will be your first go-to, and certainly if you can afford that, I would go with it because it's going to be familiar to you and you're going to have pretty good coverage because you'll still be on your group plan. If you find that that's too expensive, you do have a few options. You can go with a private market plan, or you can go with an ACA plan because losing your health coverage that in that way qualifies you for special enrollment. So normally you wouldn't be able to get that until November, but because of everything that's going on, losing your health insurance right now because you lost your job qualifies you for a special enrollment. Depending on what your income was or is, that could also get a little pricey too. So again, if you're relatively healthy, you just want something to get you through. We have short-term plans that we can get you through November. If you're in the state of Florida, we can get you plans up to 3 years that are guaranteed renewable, which are really nice as well. So you do have options. If you are very strapped for cash, zero income in your family, there's also Medicaid. It's also an option.
And it's good to know that there's a lot of options out there because I know for me, I was laid off once before, and the uncertainty of not knowing what to do or where to go, or what my options were is really adding on to the financial stress and not having a job, and worrying about what your future is going to look like. Just not having health insurance is definitely a scary thing, for a lot of people, especially considering this is a health pandemic. So, that's good to know that there are options out there for people. Because this is so new to me, to everybody really, does health insurance cover the testing, the cost of testing?
Yeah, so actually I believe they federally mandated it to where like testing is completely covered whether you're insured or not insured at this point. I know all the private market carriers have been very cooperative so far, so testing is definitely covered right now.
That's good. That's good to know that, like, you don't have to have, because I've had that with plans in the past where you don't want to go to the doctor because then you get a test that costs you, $600 out of pocket, and it's just for them to tell you that it's a bad case of allergies or a cold. So,
That
uh,
actually happened to me recently. So the carrier I have, I went to an urgent care because we came back from a trip. I had a really sore throat. That was my only thing, but I was trying to be responsible, get ahead of it. And when I got my explanation of benefits back that showed me, this was the flu test, and by the way, that was $300 test, it came and it showed me, but all I owed was my $50 copay because the way I had my insurance set up, whatever I get done at urgent care is covered at 100%. I just have my copay.
that's awesome. That's good to know. And so then, does insurance, like, is it covering treatment for people that do actually need treatment that end up being hospitalized? I mean, I know there's not really much you can do if you have a mild case and they kind of send you home to treat the symptoms.
So it depends on what you have. So I know there's a lot of Medicare plans that are covering treatment. I know that United Healthcare just put out a thing where I think they're also working with people with their treatment, whether you're insured or not. United Healthcare has actually really stepped up to try to do their part throughout all of this. And then last but not least, if you already had insurance and you go and you need treatment, deductible co-insurance, it's going to cover this because it is considered an illness. And I'm certainly available to take a look at anyone's policy who needs that, just to make sure that that's in that writing. And if not, we're gonna get you on a better plan, okay? Because it should be covered at this point.
Yeah, absolutely. And so, I mean, so heaven forbid, you do end up getting sick and you don't have insurance. That's probably one of my biggest fears is, getting sick with something terrible like COVID-19 and not having insurance. How much does treatment cost? I mean, are there numbers out for that yet?
There are some numbers. We've been seeing some things where I saw one where it cost probably about $36,000 to around $40,000 for the cost of treatment. Because if you think about it, if it's getting bad enough, you're in ICU, you're on ventilators, you're on some pretty expensive stuff. So the price really gets up there. So you definitely want to be insured during this time. Anything,
Absolutely.
something's better than nothing, really.
Yeah, absolutely. I'd rather be stuck with a $5,000 deductible than a $36,000 hospital bill. So what can you do if you're not insured right now? Like, what are people's options? I know you mentioned that like if you lost your health insurance due to ACA or due to COVID, the ACA is available for you as a special enrollment. But like, say for whatever reason you didn't have insurance before anyway, you're just uninsured. What are some of the options out there for people to get?
It's a little more income contingent on your income. I know some people, you can apply for Medicaid if you really need it, but that's pretty much poverty level, right? Another option is to just get insured normally. Even if you have pre-existing conditions, we have guaranteed issue plans. And then, lastly, if it's just really not in the cards for you, I was reading an article that United Healthcare put out that they're trying to help people who aren't insured. So I don't know the logistics of that, but I would definitely reach out to them and see what, if you, say you do have these bills, definitely reach out to them and say, hey, I read this on your website about you helping the uninsured. What's going on with that? Can I be one of those people,
Absolutely. And we'll include a link to that here for you guys so you can check that information out. I'm sure like a lot of things, the market is just changing rapidly. It's hard to stay on top of everything. So, it's good to know that you have, that people have somebody like you, an expert in the field that can, they can reach out to and have their plans looked at. I mean, I know that's something that you did for us. Originally, we didn't plan on changing. We thought we had a decent enough plan. But then when we looked at what options we actually had out there, it was like, oh, wow, we've been overpaying for a whole lot of nothing right now. So it's good that you have that option for people.
I think
And so, go ahead.
you have a plan enhancer. So if one of you did get hospitalized with your illness, that plan enhancer is going to wipe away your deductible anyway.
Mm-hmm.
Just in case you didn't remember that.
I do. I think about that all the time. I'm like, good to know it's there. So that's good. And so, is there anything else you want to add about the current insurance marketplace or any recommendations for people, things to think about, keep in mind, anything like that?
As far as insurance goes, again, something is better than nothing right now. Even if we put you on an indemnity plan, some of those are still paying $4,000 a day if you're in ICU. So something's better than nothing. Definitely reach out. If it's not with me, with another broker or agent, but just get something for coverage. Anything.
Yeah, absolutely. And that's the other thing I do remember is, with talking to you guys was that, there is a big difference. A lot of people don't know unless you're in the industry, but like the difference between an insurance broker who can go to a non-captive broker who can go to multiple different companies as opposed to calling up United Healthcare or Blue Cross or whatever, Florida Blue, whatever it's called down here, calling them individually, actually working with an insurance broker who can navigate through all the different plans and kind of show you all your best options. And so that's definitely, if you are going to reach out to somebody that's not Briana, definitely make sure that you reach out to somebody who's an insurance broker and can look at multiple plans. And I know one thing I've learned about Healthcare Solutions team is that you guys have a vast network of insurance companies.
Yeah, we all work together too. So if for some reason I'm not contracted with the carrier that I really feel you should be with, there's another agent in our brokerage who is. So really, when we say we have access to hundreds of plans, we mean it, because we always do what's best by the client, you know. So, and I'm actually contracted with United Healthcare. I'm contracted with a carrier that uses the Aetna network. There's tons.
Mm-hmm. Tons of options. Yeah, that's one thing that we really appreciated about you guys, helping us get the best plan for us and most flexibility. And it's honestly, we've had to use it already. My husband was actually sick at the beginning of March, and it came in handy, again, going through kind of like you did, the flu test, the strep test, all those things, and just having to pay, our office visit was, definitely worth it. So we appreciate that for sure. So now tell me, I'm gonna throw you a curveball here, but what's one thing you are looking forward to doing once you can finally get out of the house again?
Honestly, just going back to the beach. I keep thinking about the beach lately. Not today, but I've been doing a lot of braids and just trying to get like beachy hair just to feel that vibe. I don't know, it's kind of strange, but also, if you hear the dog, it is thundering. He likes to bark.
That's okay. That's all right. I know, I hear it too. The thunder just cracked outside our window too. So I'm like, this is going to be a good day for like relaxing, I guess, maybe, who knows. But yeah, I'm right there with you. I'm looking forward to the beach, and I really hope that, we can get to somewhat back to normal so we can enjoy some of the upcoming holidays over the summer and, enjoy our neighbors and our friends again. So I'm right there with you. I'm looking forward to getting out of here.
I really miss like hugs.
Yeah.
Took those for granted before, but I'm like, I could use a hug right now.
Right. Exactly. Well, awesome. Thank you so much, Briana, for joining me again today. I really appreciate you coming on and kind of, I'm trying to do this series where I'm going to introduce a lot of my friends to the professionals that I know in their respective fields. And I know a lot of you guys are there to review their options and their plans. Like, there's no cost to them to call you and say, hey, look at what I've got. What, can you do better? So I really, appreciate you spending the time with me today so that we can kind of educate some people. And if anybody needs health insurance, or if you just want to have your plan looked at to make sure that you're well covered, definitely give Briana a call. She was absolutely awesome for us. So thanks so much.
And happy to do it, guys. Seriously, we're in a phase right now where like we just care. We just want to help.